The pandemic has taken a toll on people's mental health, including kids who just recently returned to school. How can we take care of children's mental well-being? Let's speak now to Dr. Francis Dimalanta of the Institute of Pediatrics and Child Health at St. Luke's Medical Center, Global City. Doctor, thank you so much for joining us. Having more than 25 years of experience in child care relations, what do you think are the mental health challenges that most Filipino children face today?
Thank you for guesting tonight, sir. And yes, there's a lot of problems children are facing now, depending on their age group. We have the children who are what we call those born, the pandemic babies, who have now some kind of social malnutrition, not being able to learn social emotionally because they were kept in the homes. Then you have the preschool children who are now awkward going back to school. Same with those older children and adolescents who are faced with anxiety, fear for the disease itself and how they might get infected. And as a whole, the social relationships, because again, we as children, we learn through other people, the modeling of that behavior. And therefore now, more than ever, the mental health issues have quadrupled.
There are different levels that you just mentioned, Doc Francis, on mental health challenges. What is your advice right now to parents who have kids experiencing mental health issues?
For them to understand and empathize, I think a key thing here is that we have to ask and listen. Let's not tell them you shouldn't be feeling this way. We're far better than others and all. You need to listen to them. We need to be there for them. And you have to model that behavior. And I'd also want to tell parents out there to take care of themselves first before they can take care of their children. You cannot pour from an empty cup, they say. So again, I think open communication lines, knowing how they are in school, their friends, will make you will alert you to things that may be red flag signs that you may see with your children so that you can seek help because help is available.
Doc Francis, your advice is indeed very useful for parents because we have to be there for our child every step of the way, every little problem that they face, because many children do not really express their feelings. They bottle it up most of the time.
True. Yes, because they're not allowed to talk, to speak up. But then again, our world has been changing. And with this change, we have to be more accepting. I guess we can't even tell them we were raised this way. Things were like this then. Now we need to learn how to understand them more, maybe bend a little bit backward. We created these children. So it's not about being Gen Z, Gen X, the boomers. Let's just try to come together and speak with love and kindness and understanding. That's unconditional love as well.
Unconditional love indeed, Doc Francis, and we have to guide them, especially now when they're growing up. I mean, living at home within the four corners of the room, studying, but at the same time also playing video games, exposed to all sorts of social media. Doctor, both good and bad.
Yes. We have to make social media their friend. We can't just keep telling them, don't be on social media. That's their form of learning right now. You would know that 40% of the total Philippine population is less than 18. So that's the pediatric age group. And children about 5 to 15 years old, about 10 to 15% are affected by mental health problems. So when you tell them about the gadgets, you bought them, so you should have rules for them. However, let's just be kinder. Because how many of us stay up so late watching the Netflix or your Korean telenovelas, right? So you have to be a model for your child in watching and using these gadgets.
You have to watch it together and watch these videos as a family, no? And I mean, these kids as well have to share with the parents what they're also watching. Because if you always tell them, don't do this, don't do that, they will, keep it. They will start keeping the videos that they're watching from their parents.
Yes, that's why it's always important to have open lines of communication. You don't ask them how's school or how was school. They'll answer you good or not good.
Yes, yes.
Maybe you can share your experience. Do you know that dad had such a rough time in work today? So who made it difficult for you in school? Probably that's what you can ask. Or a mom can say, I was so happy a friend of mine called me today and took me out. Who made you happy today, anak? Di ba? Parang we need to get back to the family, which is our source of support and to get us through all of these life's challenges.
Doc Francis, I had a chat previously, from someone from the National Mental Health Association, and he said that suicidal thoughts are also escalating over the past months due to what? Economic hardship, feelings of isolation, exhaustion, mental stress, and they can't talk to their parents because their parents are also working parents. So how
Exactly.
should parents deal with this, with these suicidal thoughts? And there was even one example wherein someone tried to call the suicide hotline service and couldn't even get through.
Yes, it's true. The WHO says that 16.8% of Filipino students aged 13 to 17 have attempted suicide at least once within a year before 2015. And this has escalated now post-pandemic. So when they tell you about their suicidal thoughts and ideation, you don't tell them you shouldn't think that way. You ask them, how can I help you? How can we seek help together? What are the things I can do for you? You just don't tell them to sweep the feelings under the rug, but actually talk about it and seek help. Yes, we are not equipped by having enough of these hotlines to train. That's why there has been a lot of mental health summits, which we were both part of, where people are coming together. We're all collaborating in the very same way that the Philippine Pediatric Society has put up a task force on mental health for children and youth in 2016, and we continue to partner with all other organizations, all other agencies, so that we can make ourselves available down to the barangay level and to equip them things what they can do. I guess one key point here is allow them to play. We should all be children again and not frivolous play, but engage in other things like sports, music, arts, theater, reading. These are things that you can do together as a family so that they can feel that you are supportive of them.
Thank you so much for your very valuable advice on mental health for parents and for their children, Dr. Francis Dimalanta of the St. Luke's Medical Center, Global City.